So, Becca, I just want to make sure that I have everything that I need here to completely understand what's going on with your situation, so that way I can help better assess you. That way, moving forward, we have the best treatment plan made for you. That way, we can get you back on the right track to better health. So, you're currently having some right-sided chest pain, which has been going on for about 2 years now, and this chest pain kind of goes up in here and then right on that right scapula. And it's been bothering you, like I said, for about 2 years. This is something that you're concerned with because it's affecting your daily routines, your work habits, as well as you used to be a former bodybuilder. And so now you've completely cut out exercise because this pain has been causing you so much grief and trouble. So you're not able to do really anything because of the pain. Um, this right-sided chest pain is something that hasn't been getting any better over the course of the last 2 years, um, causing, again, pain in your right scap and up in here around the trap and everything, which you've attempted to treat via chiropractic care, which is awesome. That's great that you've been utilizing chiropractic care, as well as acupuncture, excuse me, ice and rest, some over-the-counter medications, but nothing really has seemed to be helping. Um, You've had some previous imaging, which shows some costochondritis and a perineural cyst, um, which that's something that's excuse me. Anyways, so things like military press, anything over the head, Z press, kettlebell carry, suitcase carry, all these types of activities or overhead or anything dealing with this right side or uh, movements that make this pain worse. So based off of our assessment, based off of the findings and everything with your former imaging, with the history that you provided with us today, um, the something it's called rotator cuff strain is what I believe is what we're dealing with here. Um, this is something that isn't uncommon. Can be a pretty commonplace actually with, like you said, you used to be a former bodybuilder, things like that, as well as your work habits and things that can be pretty common in some people. So it's not something to really get worked up about. This is something that we could actually fix and help you out with. But I know that you've got a lot going on right now. You've had this pain for so long, for 2 years, this recurring pain, and nothing's helped, and it's not gone away. And so I know that that's given you some added stress, but I'd like to give you some recommendations to help that out, to help combat the stress and anxiety. So, in my honest opinion, I believe that you should continue to work out, get back into working out, but using moves and exercises that doesn't cause you any pain. So whether that's walking, running, or lower body exercise, what have you, anything at all to get you back into the gym, get you back into exercising, that doesn't cause you any added pain. Because exercise is actually a really good form of stress relief. There's a lot of studies been shown that exercise not only helps physical health, but it also helps with mental health. So it helps reduce stress and gives you a better positive outlook on life. So I really think getting back into the gym and getting back into working out would definitely help along with the treatment protocol that we're going to be giving you. So I think you're a prime candidate again for chiropractic care. I think we can continue with that. But I think what we'll do, is add in some exercises. These exercises are meant to hold the adjustments longer as well as strengthen some areas that might be weakened due to the ongoing pain. So the first exercise is what's called an eccentric shoulder external rotation exercise. So what I'm going to have you do is with a very light dumbbell, 1 to 2 pounds. We can progress to 3, 4 pounds later, but very lightweight. What I'm going to have you do is for this one, what we're going to do is sideline with your right shoulder up. We are going to start with this hand here, and we are going to eccentrically bring the dumbbell down all the way, and then we're going to drop it. And then we're going to bring our hand back up, and with our off hand, we're going to bring the dumbbell back to our go ahead and we're going to do those again. Typically, a 4 count we do pretty good for this exercise. So, but what we're doing is we're essentially contracting those muscles here in the shoulder to help kind of build those up. The next one is going to be an eccentric scapular stabilizing exercise. So for this one, we're going to be side lying again, and this one we're actually going to be straight up, and we're going to come all the way down, eccentrically contracting the shoulder stabilizers, the scapular stabilizers, and we're going to bring it back in, up, up, and do it all over again. And like I said before on the external rotation exercise, a 4 count eccentric contraction is good enough. We could even slow that down a little bit more. And then the last exercise is actually a low row. So I'm sure with your bodybuilding exercise background, you've probably done this one before. But what we're going to do is we're going to stabilize here, and we're going to bring the shoulder back and make sure that that dumbbell hits our hip pocket. Make sure that we're bringing the shoulder and the scapula all the way back and retracting and contracting that. And we're going to do those for a number of sets and reps with a very low weight, but making sure that we're keeping that good posture, making sure that we're keeping that good plane of motion, and building up that shoulder complex. So, as I stated before, I think you're a great candidate for chiropractic care, and I believe that we can definitely help you here. So, looking forward to your treatment.